Cancer. The very word evokes fear and uncertainty. Cancer affects all ages, including children. Pediatric cancer is a leading cause of death in children. It often receives less attention and funding. This silent epidemic demands our attention and commitment. Every child diagnosed faces unique challenges. From diagnosis to treatment, pediatric cancer impacts lives. We must shed light on their challenges and triumphs, exploring advancements in treatment and resilience, and the hope that fuels the pursuit of a cure. Childhood cancer presents unique challenges that distinguish it from adult cancers. Children, with their developing bodies and minds, experience the disease and its treatment differently than adults. One significant distinction lies in the types of cancers that typically affect children. While adult cancers often arise from epithelial cells, such as those lining the lungs or breast, pediatric cancers frequently originate in the developing cells of the bone marrow, brain, and other organ systems. These cancers, known as sarcomas, leukemias, and lymphomas, tend to grow and spread rapidly, demanding aggressive and timely treatment. Furthermore, children's developing organs and tissues are particularly vulnerable to the side effects of cancer treatment, which can have long-term consequences on their growth, development, and overall well-being. Chemotherapy, radiation therapy, and surgery, the cornerstones of pediatric cancer treatment, can lead to a range of side effects, including nausea, vomiting, hair loss, fatigue, infection, and organ damage. These side effects can significantly impact a child's quality of life, interfering with their ability to attend school, engage in social activities, and enjoy the simple joys of childhood. Treating pediatric cancer requires a specialized approach that considers the unique needs of growing children. Treatment protocols are carefully tailored to each child's specific cancer type, stage of disease, and overall health. Chemotherapy, the use of powerful drugs to kill cancer cells, remains a cornerstone of pediatric cancer treatment. These drugs work by targeting rapidly dividing cells, including cancer cells, but can also affect healthy cells, leading to side effects. Radiation therapy, which uses high-energy rays to destroy cancer cells, may also be employed either alone or in combination with chemotherapy. Surgery, while less common in pediatric cancers compared to adult cancers, may be necessary to remove tumors or obtain tissue samples for diagnosis. In recent years, there have been significant advancements in pediatric cancer treatment, leading to improved survival rates for many types of childhood cancers. These advancements include the development of targeted therapies, which specifically attack cancer cells while sparing healthy cells, and immunotherapy, which harnesses the body's own immune system to fight cancer. A cancer diagnosis sends shockwaves through the entire family, leaving no member untouched by its emotional toll. For children, the diagnosis can be particularly daunting, as they grapple with complex medical terms, the uncertainty of their future, and the disruption to their daily routines. Young children may not fully comprehend the concept of cancer, but they are acutely aware of changes in their bodies, the need for frequent hospital visits, and the separation from loved ones. Adolescents, on the other hand, may have a better understanding of the disease but struggle with issues of identity, body image, and fear of death. The emotional impact of pediatric cancer extends far beyond the child, encompassing parents, siblings, and extended family members. Parents face the unimaginable task of coping with their child's illness while providing unwavering support and navigating complex medical decisions. Siblings often experience a range of emotions, including fear, resentment, guilt, and confusion. They may feel neglected as the focus shifts to their sick sibling, or they may struggle to understand the changes occurring within their family. Section 5. Supporting the family unit, a shared journey. Navigating pediatric cancer is a shared journey requiring a strong support system. Hospitals provide medical, emotional, and psychosocial support to children and families. Oncology teams work collaboratively to address patients' multifaceted needs. Child life specialists help children cope with the hospital environment. Support groups offer a space to connect and share experiences. Financial assistance programs alleviate the economic burden of treatment. Section 6. The long road ahead. Late effects of pediatric cancer. Advances in treatment have improved survival rates, but the journey doesn't end with treatment. Many survivors experience late effects, health problems that occur months or years after treatment. These can range from mild to life-threatening, affecting any organ system. Common late effects include heart problems, lung damage, infertility, secondary cancers, cognitive impairments, and psychosocial challenges. Regular follow-up care is crucial for monitoring and managing health problems. Transitioning to adult healthcare can be challenging for survivors. Section 7. Emerging Therapies, a beacon of hope. Despite the challenges posed by pediatric cancer, there is a palpable sense of hope that permeates the field. Researchers across the globe are working tirelessly to develop new and innovative treatments for childhood cancers, with the goal of improving survival rates, reducing treatment-related side effects, and enhancing the quality of life for survivors. One promising area of research is targeted therapy. Unlike traditional chemotherapy drugs that affect all rapidly dividing cells, targeted therapies are designed to specifically attack cancer cells while sparing healthy cells. These therapies work by targeting specific molecules or pathways that are essential for cancer cell growth and survival. Immunotherapy, another groundbreaking approach to cancer treatment, harnesses the power of the body's own immune system to recognize and destroy cancer cells. Immunotherapies work by either stimulating the immune system to mount a more robust attack against cancer cells, or by removing the brakes that prevent the immune system from recognizing and attacking cancer cells. Section 8. Clinical Trials Pioneering New Treatments. Clinical trials play a crucial role in developing new cancer treatments. They provide essential information about the safety and effectiveness of new treatments. Pediatric trials offer children access to cutting-edge treatments. By participating, children benefit from new therapies and contribute to future advancements. Clinical trials ensure participants' safety and well-being. New treatments undergo rigorous preclinical testing before human trials. Promising results lead to human testing through clinical trial phases. Participants are closely monitored and treatment plans adjusted as needed. Section 9. The Power of Research, Unlocking Cures. Research is the cornerstone of progress in the fight against pediatric cancer. By unraveling the complex biology of childhood cancers, researchers can identify new targets for therapy, develop more effective and less toxic treatments, and ultimately find cures for these devastating diseases. Pediatric cancer research encompasses a wide range of disciplines, from basic science research to clinical trials. Basic science research focuses on understanding the fundamental mechanisms that drive cancer development and progression. This knowledge can then be used to develop new strategies to prevent, diagnose, and treat cancer. Translational research bridges the gap between basic science and clinical practice, aiming to translate laboratory discoveries into new treatments and diagnostic tools for patients. Funding for pediatric cancer research is essential for driving progress in the field. Section 10. Advocacy and Awareness Amplifying Young Voices. Raising awareness about pediatric cancer is paramount to securing increased funding for research, improving access to quality care, and providing support for families affected by this disease. Advocacy efforts play a vital role in amplifying the voices of children with cancer and their families, ensuring that their needs are heard and addressed by policymakers, healthcare providers, and the public. September is recognized as Childhood Cancer Awareness Month, a time to shine a spotlight on the challenges and triumphs of pediatric cancer, celebrate the courage and resilience of these young warriors, and advocate for increased funding and support. Throughout the year, various organizations and initiatives work tirelessly to raise awareness about pediatric cancer, support families affected by the disease, and advocate for policies that promote research and improve access to care. These organizations provide valuable resources to families, connect them with support networks, and fund groundbreaking research to find cures for childhood cancers. Section 11. A Future Filled with Hope. Striving for a world without childhood cancer. While pediatric cancer remains a formidable adversary, the future is filled with hope. Advances in treatment, coupled with the unwavering dedication of researchers, clinicians, and advocates, are paving the way towards a brighter future for children diagnosed with cancer. With each passing year, survival rates for many childhood cancers continue to improve, and the development of new and innovative treatments offers hope for even better outcomes in the years to come. The journey of pediatric cancer is one marked by both challenges and triumphs. It is a journey that demands our unwavering compassion, unwavering support, and an unyielding commitment to finding cures for these devastating diseases. By working together, we can create a world where no child has to endure the pain and suffering of cancer, a world where every child has the opportunity to live a long, healthy, and fulfilling life.